One in three women deal with urinary incontinence. And while it's so common, most women can feel like they have very few solutions. And this is just something that they have to deal with. But what's exciting is there's actually a different solution that most women don't realize. And today I have Jennifer Sobel with me today to talk about that really fun solution. Jennifer, thanks so much for being with me here today.
Thank you so much for having me. I'm thrilled to be here.
Yeah. So first, I'd love to hear your story into how you discovered this new solution for urinary incontinence.
Yeah. Honestly, I was surprised as anybody else. I've been teaching belly dance professionally for over 20 years, and I used to teach a regular class at Gold's Gym in Oakland, California. And one day, one of my regular students came up to me after class as we were all getting our stuff together. And she came up to me. She had this huge smile on her face, and she said, something really exciting to tell you. And I was like, what? And she said, well, since I've been belly dancing, I don't have bladder leaking anymore. And I was like, fantastic. And to be honest, I forgot about it for a couple of years. And then I was trying to think, I mean, obviously, belly dance has been my passion for most of my life. And I was trying to think of what I wanted to create. And I was at the gym and I saw this commercial for a bladder leaking drug. And in that moment, I put the two things together and I thought, I wonder if this would be helpful to more women. And as I did the research, I was shocked at how many women have this problem and how prevalent it is and how you don't hear about it because
Mhm.
so many women are ashamed to talk about it.
Yeah. I mean, it definitely isn't a sexy thing to want to talk about, right? It can feel so embarrassing. But like we were saying, it's so common, especially after having kids later on in life. Our pelvic
Right.
floor and things start changing, and there really isn't a conversation publicly about this. And it's really, to me, such a shame that so many women are having to deal with this and not be able to talk about it, just feel like they have to be embarrassed and live with it. And yeah.
Yeah, and I think I'm not exactly sure of the statistic, but I think it's something like 25% of women don't even tell their own doctor
Mm.
that they have bladder leaking. And the sad part of it is that if women don't talk about it, they don't get the resources, they don't get the help that they need. And they don't realize it's such a common problem. Most women don't even talk to their best friends about it.
Mhm.
And so I'm on a mission to not only let women know that there is actually a fun solution to this problem that's also a really good workout, that you don't have to live with this. It's a very common problem, but it's not normal and it's not something that you should just accept as something you're just going to deal with for the rest of your life and limit the things you can do, your freedom, how you feel in your body. No woman should have to do that for the rest of her life.
Yeah, I mean, I've heard so many women just kind of casually or jokingly say things like, "Oh, I just can't run anymore," or "Now I have to wear a pad every time I go running," something like that, or "I can't jump on the trampoline with my kids anymore." And it's like, yeah, why should we have to just accept not doing certain things that we love for the rest of our lives?
Right. Yeah, who says you can't? It's
Mm.
only because most women have just accepted it, and, I think that there's, this kind of unsaid conversation around that, yeah, you just accept these things that happen to your body, and it's just the way it is.
Yeah. Yeah, you mentioned some of the other solutions, like this commercial for a medication, for example. And
Mhm.
outside of that, kind of what have been the solutions that women are offered when they actually are seeking help?
Well, I hear from most women that when they go and they do happen to talk to their doctor about this, that usually their doctor gives them a quote prescription for Kegel exercises. And most women, as we know, are simply not going to do them. Most women,
Mhm.
because you're not sure you're doing it correctly. They're boring.
Mhm.
So I think that's usually the first thing that a woman is told. And then, I think if it's very severe, there might be looking into surgical procedures. But I do think that one of the best solutions that is available medically is pelvic floor physical therapy.
Mhm.
And I think that, a lot of women who do belly dance can often relieve or sometimes even completely eliminate their bladder leaking with belly dance. But it's also a good complement to pelvic floor physical therapy
Yeah.
because most women, if they're doing that, there's certain things that they're supposed to do at home. And this is a great home exercise accompaniment that is actually fun.
Yeah, that makes sense to me because I do. I am a big fan of pelvic floor physical therapy. And especially as you mentioned Kegels, what I've learned just talking to pelvic floor physical therapists is that it's not always just that you need to strengthen things. Sometimes things are too tight or out of balance. And so getting that assessed, I think, is a great idea. But even that, like some of the exercises that they might prescribe might also be really boring. And so, yeah, what a fun way to have, okay, like, get things assessed, do things in the office with them, and then be able to use this at home as a fun exercise and release for creativity, I'm sure, too. And then also be able to help this, like help the,
Yeah.
yeah.
Yeah, exactly. And you made me think of something with what you just said about, a lot of women do Kegels, which can actually make it worse because their pelvic floor is actually holding too much tension. And one of the cool things about belly dancing movements is that there's a strengthening and also a relaxation phase to the movement so that
Hmm.
your body doesn't get stuck in that contracted phase.
Hmm.
You let go, you strengthen, you contract, and then you let go. And it's also a really good practice, not only just for your physical health, but your nervous system as well. And
Hmm.
that you can teach your body that it doesn't have to hold on to stress.
Hmm. Yeah. I mean, I'm sure so many women don't realize that they could be holding stress in their pelvic floor, just like you could kind of hold stress anywhere in your body. And if you think about some of the trauma that happens down there, especially with
Right.
childbirth, it's like, no wonder you'd be like, I'm protecting this area. And so, yeah, to be able to have some safety there, some strengthening and some relaxation, really creating balance, that sounds perfect.
Oh, I was just gonna say that what I think is or let's just say what I love to witness and observe in my students is just how this dance can help you just feel better in your own skin. And when I talk to some of my students who have to wear pee pads and do things like that, it can really like crush your self-esteem and your confidence. And this movement is so healing in its ability to make you feel confident again.
That's awesome. We could all use a dose of that, especially after like that. Yeah, you probably feel like you're wearing a diaper if you're wearing this like thick pad all the time or something.
Right.
And man, that doesn't feel, sexy, like I said earlier, or, very like where you
Right.
can really be confident feeling like that. Yeah. Well, I'd love to hear about the specific moves. Like, what is it with belly dance that helps, create some strengthening and relaxing in the pelvic floor?
Yeah. It I mean, most belly dance movements are just naturally engaging your pelvic floor and your
Mhm.
hips. When we do, a movement with our hip up, or we drop our hip, or we tuck our pelvis, or we release, or we do these body wave movements, you're constantly activating those muscles. And I think that's why it was so interesting, my student telling me that after class, because she didn't know that she wasn't trying to strengthen her pelvic floor. It
Mhm.
was just a byproduct. And I think that's what's so interesting about it is that you're doing the movements and you're naturally just activating those muscles. I mean, you can go deeper into it and, you know, understand the movement better and how you can maybe activate those muscles more effectively, but if you're belly dancing, you're naturally using your hips and your pelvis and you're activating those muscles just to be able to do the movements.
Yeah, that's awesome. And I feel like those types of movements are things that are not really present in other exercises or other areas of our life. We're so nowadays very like mentioned running or things like that. They're just in this one motion consistently. And so, yeah, being able to really move in all these different directions sounds like it would, make
That's
sense
such a
to
great
balance.
point. Yeah. I mean, it's really in all planes of motion that, like you said, we don't do very much. And I think there's another challenge that we have to deal with in modern world is that we're sitting most of the day.
Mhm.
And that creates all kinds of imbalance, also in the pelvic floor, just because we're sitting all the time. So to be able to move your body in that way where you're strengthening the core, you're also relaxing the low back and the hip muscles and increasing mobility is very helpful for just this modern day problem that we're in.
Mhm. Yeah, that makes sense. Now, what's kind of the time frame of how long it would take someone to do? Like, how regularly would they have to be doing belly dancing? Are there specific moves they need to be doing regularly?
Yeah, I've noticed that with my student that if they could just do honestly 10 minutes a day,
Mhm.
sometimes even 5, you can get results. And it's more about the consistency than it is the time spent.
Mm.
One of my programs is like in 10 minutes for 21 days, and people get really good results in only 10 minutes. So it
Mhm.
doesn't have to be some big thing. And once you learn the movements, you often find yourself doing these moves throughout the day when you're brushing your teeth or
Mhm.
you're waiting for your coffee or whatever it might be to really integrate it into your daily life. But it really doesn't take that much. It's really more about consistency more than anything. And I focus on the fun, and just enjoy it. Have
Mhm.
fun moving your body in different ways and you're going to get results. It doesn't have to be perfect technique. And if there's women out there, I know a lot of women are like, "Oh, I can't belly dance. I
Mhm.
couldn't possibly. I'm so uncoordinated." It's not true. It's just it's a skill like anything else and it takes time to strengthen those muscles.
Mhm. Well, that sounds so approachable. I mean, to be able to do something, and of course, consistency is everything, right? For
Right.
like the habits we're creating, but to be able to just do 10 minutes a day, that sounds very approachable. And I think I would, as you were saying that, doing it while they're making their coffee, I feel like I would like, yeah, naturally, if it's fun, you're like, oh yeah, I'm going to kind of like practice this while I'm doing other things. Then that's so easy to integrate then too.
Yeah, it really, really adds up. I mean, I love shimmying. Shimmying is my thing, and I really got good at shimmying, not through like a designated practice time, but it was literally just in those spare moments throughout the day, and it's surprisingly effective, like how those little moments add up.
Yeah. Oh, that's so cool. Any like tips or other things that you would want to add here in terms of someone who maybe is dealing with, bladder leakage, what they can do or where to start?
Yeah, I think the most important first step is to shift your mindset around it and start to think that I can do something about this. And I don't need to just accept this as my life now. That is the first step. And in fact, I got an email from one of my students, and she just thanked me for putting out the information because she was stuck in that mindset where she didn't think there was anything she could do about it. And so then she
Mhm.
started to talk to her medical care team and she's getting help now. So first thing is don't accept it. I mean,
Mhm.
even if you have to cross your legs when you sneeze, that's still a problem.
Mhm.
And you don't want it to get worse over time.
Mhm.
I don't this is interesting statistic, but a lot of people wind up in nursing homes because of incontinence.
Mhm.
So
Mhm.
it's not something you just wanna, "Yeah, we'll see how this goes forever." Like, let me
Mhm.
sit down and see how your life opens up. So I would say that's the first thing, and then try to approach it as holistically as you can because there are holistic options, and I think that that would be my main advice.
Yeah, I think that's so wise because again, probably so many women are like, well, this is just it. And so having that shift is going to be a very important first step to just realize that, okay, wait, there is something that could change here. This doesn't have to be like this forever. And I love that you're pointing out that that long game piece of farther down the line, if you don't do anything about it, then it could just get worse and worse and worse. And when you are in your later years, it could change what you're able to do on your own. That's huge. We don't think about that when we're younger, but when you're in that age and it's just too late, you're like, man, you wish you could have done something about it differently. And on that point too, I mean, even just like urinary tract infections for women end up being a huge cause of mortality, meaning women died from urinary tract infections too later on in life. And I feel like that's probably very slippery slope with the two of them, that if you're, having incontinence, you're doing some different solutions, maybe some of those treatments, like those surgeries and things are making things even worse, is if you can attack things earlier on when those tissues are probably much more responsive, then
Right.
that's huge.
Totally. And I mean, and then you have some tools that you do regularly to address the problem, relieve it, or maybe even completely eliminate it. And then you have tools. It's like if you take a vitamin every day, like there are things you do to maintain your health.
Hmm.
And it's not about being broken. I think a lot of women, and I get it, I'm going through perimenopause myself, and you do kind of feel that way at times, like your body is broken and your body got hijacked.
Hmm.
But your body's not broken. It's a call to balance. It needs more attention.
Hmm.
I used to be an acupuncturist, so I approach
Hmm.
things from that holistic perspective, but it's like you're not broken. Your body needs something from you. It needs greater balance.
Hmm.
And you're doing something lovely for yourself. You're not trying to fix it. You're trying to bring yourself into balance. It's a call.
Hmm. Yeah, I love that. Yeah. And it's like, there's so much talk about muscle building and for longevity, lifting weights and things like that. And then it's just like, oh, well, we're just not going to talk about the pelvic floor. Like, we'll just ignore those muscles because they're somewhat taboo to talk about still. Like, no, of course, like we need maintenance there. And like we were saying, like that's part of our body's systems of how things are moving. And especially if we've had children and given birth, like there's a lot of action that's happened there. Why wouldn't we think about like maintaining and supporting that area of our body just like anything else?
Right. And I think you really spoke to something important about that part of the body having a charge, a connotation that
Hmm.
people don't want to talk about. There's nothing shameful about it. It's just a part of our body.
Hmm.
And interestingly, so connected to a woman's freedom
Hmm.
in her life and how much she feels in control of her own body. This is
Hmm.
very, very important to feel that. And no woman should have in the back of her mind the thought of leaking if
Hmm.
she's going to sneeze or cough or should I go to a comedy show? Like
Hmm.
no woman should be thinking about these things. It's important.
Yeah, absolutely. Yeah, just to feel, like you said, having that balance everywhere and not feeling, almost like out of control in a certain area. Absolutely.
Right.
Yeah. Well, where can women find you and learn about your programs? Because it sounds so much fun. I want to check them out
It's
just
fun.
to like add in a little piece. Why not add a little extra different movement?
Yeah. Yeah, people can go to thebellydancesolution.com.
Awesome. And we'll link that in the show
Yeah,
notes too, so people can find you.
yeah, cool.
Amazing. Well, thank you so much for being here. And thank you for sharing this message. Again, it's one of those things that no one's talking about enough. And so I also really appreciate you sharing this message so that women, even if they don't, use your solution, they're still able to get that message of, hey, something could be different. Actually, this could be, you know, better. You don't have to be leaking. So I really
Right.
appreciate you for doing this work.
Thank you. Thanks for having me.
My pleasure.